Hello, everybody. Welcome to today's session of Awake, Aware, Arise. Okay. Thank you, everybody, for joining in. I see some people have already joined in. We will start with the session. Thank you for joining. Thank you. Okay. So today's discussion is going to be based on filling the potholes in women's road to empowerment and entrepreneurship. I'll discuss the topic. I'll give a little brief of what the topic is going to be around, introduce the panel, and then they will take it forward for discussion. Okay, about the topic. While Indian economy has grown at an average of about 6 to 7% a year since 1991, women's participation in labor force as represented by participation rate has continued to fall over the years. Furthermore, only 14% of business establishments in India are run by women. Structural and socio-cultural factors are as many reasons as voluntary drop-offs. As we see unprecedented levels of economic degrowth on account of the pandemic, there is a need to quickly reimagine the strategy for reviving the economy by tapping the potential of the women workforce. Against this backdrop, we invite everybody to the Awake Aware Arise conference, where our esteemed speakers would share their insights on various issues and changes regarding this journey. I will now introduce the panel who will take this discussion ahead, starting with Chetna. She is the founder of Mann, Deshi, Mahila, Sahakari Bank. Chetna is an Indian social activist working to empower women in drought-prone areas of rural India by teaching entrepreneurial skills, access to land, and means of production. Chetna and 6 other women chaired the 48th annual meeting of the World Economic Forum in Davos, Switzerland in January 2018. She's been awarded the Nari Shakti Puraskar, India's highest civilian award for women. In 1997, she set up the Mann Deshi Mahila Sahakari Bank, India's first bank for and by rural women. Mann Deshi Bank had 100,000 account holders and had loaned over $50 million to support female micro entrepreneurs in 2018. Mann Deshi Foundation runs business schools, a community radio, and a chambers of commerce for rural women micro entrepreneurs. In 2018, it had supported nearly 500,000 women. Welcome, Chetna. Next, we have Revathi Roy. She is the founder and CEO of Hey Deedee. Revathi is a serial entrepreneur who has been working towards empowering urban poor women since 2007, whether it be by pioneering Asia's first all-women taxi service, Forsh, or recently founding India's first all-women instant parcel delivery service, Hey Deedee. Currently involved in Hey Deedee, a real-time logistics platform involving an all-women fleet specially trained by Zafiro Learning Private Limited. She aims to empower underprivileged women by skilling them in two-wheeler riding, soft skills, and guaranteeing them a job on its Hey Deedee platform. Her vision is to create the world's largest last-mile delivery service logistics platform run only by women. That's a great initiative. Welcome, Revathi. Next, we have Meena. She is currently CEO and MD Portea Medical. Meena holds a BSc in Physics from Madras University and an MBA from the Indian Institute of Management in Calcutta. In 1985, shortly after earning her MBA, she took a position as a regional manager at NIIT. In 1995, Meena entered a new phase in her career, beginning with a position at Microsoft India. Over the course of her 5 years with Microsoft, Meena set up multiple business units, including the Microsoft Consulting, Internet and Application Development business service units, garnering valuable startup experience in the process. She left Microsoft in 2000 to co-found Customer Asset, a call center and BPO company. As COO of Customer Asset, Meena helped build the company into an organization of nearly 4,000 people servicing major corporate customers in the US and UK. In 2003, Meena joined Tesco as the HSC and CEO of Operations for India, being the only Indian and one of only 4 women in the Global Retail Council of Tesco, a group of 50 people who ran the company's worldwide operations. In 2013, Meena and her husband launched Growth Story, an angel investment fund and startup incubator, along with which they also acquired a home healthcare service provider, Portea Medical, where Meena now serves as a CEO and a managing director. With this platform, she has helped the company grow to a workforce of over 1,000 in 18 cities, making over 25,000 home visits each month. Meena is widely recognized for her prolific and successful entrepreneurship. Welcome, Meena. And last but never the least, our moderator, Ashu Suyash, currently the MD and CEO for CRISIL. Ashu is a member of the CRISIL board and also serves as a member of the operating committee for S&P Global. She leads CRISIL's India and global businesses, steering its efforts to deliver high quality analytics, opinions, and solutions to corporations, investors, financial institutions, policymakers, and governments. She has spent 30 plus years in the financial services sector. Over the years, she's been recognized among the top 50 women in business in India and Asia by various publications. By background, Ashu is a chartered accountant and holds a bachelor's degree in commerce and is a member of various platforms: the Primary Market Advisory Committee of Securities, the Exchange Board of India, the Advisory Committee on Corporate Insolvency and Liquidation of Insolvency, and also the Bankruptcy Bank Board of India. Welcome, Ashu, and over to you.
Thanks so much, Aishwarya, and welcome everyone to our, I hope, a very, very engaging and thought-provoking session. The platform Awake, Aware, Arise itself kind of uplifts any topic, and even more when it's about what we're about to discuss, which is related to women empowerment, women entrepreneurship. How do you fill the potholes? It is a topic that resonates with me. I feel it's something that a lot of talk happens, but not enough happens all the time. And I'm hoping today, as we discuss, many more angles, many more issues come to the forefront, and hopefully we also take away something that we can implement in our lives for ourselves and for others to really spread women empowerment and make it much easier for women to really shine. And the reason I'm not just saying in the workspace, because we often tend to ignore the caregiving aspect of every woman, which is a very, very material activity which doesn't get recognized too much. I have a very interesting statistic to share on this. S&P Global, as part of its analysis, has put out a study which shares that if you valued the caregiving work of women, you could actually put a number which is 6.6% of world GDP. It's not a number to be just ignored. And in these pandemic times where economic growth is severely constrained, I think women can do a lot to really bring back growth across the world. Just as we kick off, I think it's worth pointing out and celebrating the India Air Force Day, and celebrating on this platform, especially because President Ramnath Kovind gave the Nari Puruskar to the first female fighter pilot of the Indian Air Force, the three of them, Mohana Singh, Avani Chaturvedi, and Bhavna Kant. So I always say that sky is the limit for women as far as their potential goes. But when you put it in the context of these women, actually sky is just the beginning. So in today's times, when we're talking about the impact of COVID-19, it's worth recognizing that women are leading the way even on that front. If you think about it, Sarah Gilbert, who is the professor in vaccinology at the Oxford Institute, is leading in making the COVID-19 vaccine. And this is one of the front runners from a vaccine perspective. Also very recently, Citibank announced Jane Fraser as their first ever women CEO. And she's actually going to be the first ever woman CEO on Wall Street amongst the global banks. Actually, it's not just now. Women have led the way, and we have our panelists who have shining examples of these women. And then you have also people like Indra Nui, Ginny Romenti, Mary Bara, who have transformed and taken their organization to many heights. I'm reminded of a quote from Kofi Annan, who says that there is no tool for development that is more effective than women empowerment. So if I spoke about how we can enhance global GDP, if we count the work of caregivers, let's think about the kind of potential we could unlock from a growth perspective. Even if half of the women population actually took to the workforce. There are studies which actually say that you could add as much as 28 trillion to the world economy by 2025. So the topic that we're going to be discussing is so material. In a world that is starved of economic growth, if we fill these potholes, we empower women, we really pave the way for them to join the workforce, to take up entrepreneurship. I think it would be an immense contribution to the world. So Aishwarya spoke about the falling labor participation, female labor participation rate. And it is quite alarming because the data in 2018 suggests that we have 3 in 4 women forget not working. They're not even seeking work. That somehow, doesn't sit right with me. And as an organization in CRISIL, we actually at the entry level have 44% of our intake being women. So, the data sets just don't add up. And perhaps this is because there are several social norms that come in the way. And this, I think, applies equally to the formal sector as well as the informal sector. And there's a lot more that can be done. So, Meena, let's start with you. I want to hear your perspective on this, that are social norms coming in the way? Caregivers, they can definitely be breadwinners. So what's your view on this?
Thank you, Ashu. It's a pleasure to be here on this panel. Let me actually address this from 2 perspectives. One, I'm an entrepreneur now for nearly 20 years and I've built a number of different businesses across multiple sectors. And over the last 20 years, I've seen that the number of women entrepreneurs is still extremely low. When I started in 2000, there were none. Now there are a few. It's still a very small percentage of the total entrepreneurship that exists in this country. And I think part of it is because of the social conditioning. Like you said, there are 44% of your intake is women, and that is true for a lot of other companies in various sectors. But when it comes to doing a startup, women are still at a lot of disadvantage from a social perspective. It's now okay for women to work, and they probably are expected to pick up a career, and that's not something which is frowned upon as it was maybe 20, 30 years back. So there is a lot of encouragement. But being an entrepreneur is a different thing altogether. There's a lot more of risk. There's a lot of unsettling of their lives, and that is still being frowned upon. Women becoming entrepreneurs is still not something which is encouraged by the society or by their families. They're still expected to take up something which is settling rather than unsettling. And being an entrepreneur is extraordinarily unsettling, as I'm sure everybody knows that. So that's one aspect. The other, just speaking to the question that you specifically asked me, as a outside of hospital healthcare company, we employ a lot of people across sectors, across economic levels. They're both caregivers, like you said, as well as medical professionals, nurses, physiotherapists, doctors, etc. And I do find that this sector, the healthcare sector, tends to attract a fair bit of women. So we do have a lot of women across all the different levels of the medical professional, the healthcare professionals that we have who actually provide the service to patients. There is a nearly 50% or more than 50%. There is a representation, and they do an extremely good job. And absolutely, women tend to be not just great medical professionals, but also have the empathy. They make that little extra to embed themselves within the family in which they are providing the service, or they are able to share not just their skills, but their empathy to the patients that they are serving. So you can actually see a very distinct difference. And I do believe that women tend to be very good in the medical profession. That said, if you look across the medical field, you will find that the hospitals also, a lot of the nurses, probably about 30-40% of the doctors are women. But as you go up the ladder, there are very few women who are in senior positions in hospitals or in the healthcare sector who are calling the shots or making the decisions. So if somewhere down the line there is a ceiling which has prevented them from moving far ahead. Barring a few hospitals such as the Apollo Group, which is of course run by the family and very, very competent women running it, and it's a shining example of what women can do, but you will find that it's few and far between. That said, in the healthcare sector, some of the new age companies such as ours, which are more technology driven, and of course in my case with the woman founder, I tend to have a lot more of women participation. And I'm seeing in the medtech space also there are quite a few interesting technology startups in the healthcare space which are women.
Yeah,
so sorry for a very, very long answer to your short question.
But it does make a lot of sense. So Revathi, given your own journey and the work you do at Deedee, do you think social imbalances come in the way? What's your perspective, and how do you think we can change some of the social issues that come in the way, or even the mindset? You're on mute, Revathi.
Yeah, I am delighted to be here and see all my friends around. So, yeah, I think first of all, the work that we are doing is a very new kind of field. So, in terms of imbalance or social kind of thing, we are right there. I mean, we are right there who are creating the imbalance right now. Because we didn't have a precedent on either women drivers commercially, or even last mile delivery. We didn't really have women doing it. So we became the first ones to do it. And first movers always have Meena or any entrepreneur would agree with me that we have our advantages and we have huge disadvantages as well. Because advantages are that, people are noticing you, you are getting you're getting recognized, but that really is not translating into business. So clearly, we are the path towards reaching that one milestone is much longer for us. So as far as imbalance is concerned, we have a huge imbalance because we're already dealing with maybe 100 is to 1. So we are not even dealing with 10 is to 1. And it is going to take a very, very, very long time in this segment of logistics and last mile delivery where we will even come to balance as 50-50. I don't see it reaching in the next decade also, because and as far as mindsets are concerned, of course mindsets play a very crucial role, because your other than there is one is a major part is a mindset, because I think if you make up your mind on doing something, you may be able to, at least you will try to do it. But if you say you're never going to do it, then you're never going to try. So that is definitely there with whichever class of human beings you belong to. So, and I deal with the lowest end of the pyramid. So that things are a lot more difficult in that segment. So here we have a problem on multiple fronts. We have a biological issue also. If I'm taking younger girls, 20, 21, 22, 23, 24, whatever, I'm looking at a huge gap when they will bear children. So I'm looking at somebody working, going, coming. I don't know when they'll come back. Then I'm looking at an older category, which could be a 50 plus, where I actually have to go back and see whether all their, all the faculties are okay in the sense eyesight. Yeah, because I'm dealing with things on the road. It is a very high risk job that we do. So we deal with mindset, we deal with social imbalances, we deal with their own problems, we deal with biological problems. So for us, those become as important as anything else for growth as far as our industry is concerned. And so we have, in during COVID times, what we have also done is we've realized that their husbands have lost jobs. The girls had jobs, but their husbands have gone and lost jobs because they belong to different segments. So we've actually started taking them also now. So we are saying, chalo, let's not put it as a gender thing, that because we have jobs. So since we have jobs, we said, come. So there, slightly I'm seeing now that when the husband is also working, he's allowing the wife to kind of, work independently also. So the social imbalance is a little more in our field than in any other field, I feel.
Yeah. One angle is employment, but entrepreneurship is a totally different ball game completely, right? The kind of risk appetite one would need is also vastly different. And when I look at the numbers on the entrepreneurship side, and I think about the number of women entrepreneurs, there are few and far between. And in some ways, you will hardly find women in a lot of, if it's not a case where the daughter or the wife has taken on the baton in a large organization, you don't even see, because of the patriarchal society we live in, women or daughters taking the mantle. And then there are even fewer when you think about setting up your own company. And here I'm reminded of what Plato, the Greek philosopher, said. He said, if you want women to do what the men do, then you have to teach them in an equal kind of way. And education does play a very important role. And when I look at literacy data, and I think about India, the illiteracy rates, because that becomes more relevant, are very, very high when you think of rural India. So Chetna, with the work Mandeshi Bank does, because it's focused on rural India, it's all about encouraging women entrepreneurship there. I would like to hear from you, what are the key challenges the women there face? And in your view, how different is that from the urban side?
Thanks, Ashu. And I'm really glad to share the experiences while working with rural women. But, before I talk about the challenges of rural women, or I have always experienced with women that they think that we can do everything in spite of no education, no schooling, no travel, no exposure. And I have always get amazed that how do they think that way? I mean, let me give you an example. Recently, post-pandemic, one of the lady migrated from Mumbai because her husband lost the job. She came back, Manisha Jimal, to the village, and she started. Nobody had job, right? So she bought goats and buffaloes for her business, Manisha, and she was married because when on the day of her marriage, she got her 10th result, which she had got 80%. But her mother thought that she does not have enough money to invest in her education. And so she said that I was sitting in my marriage, but I was looking at my mark sheet. And I had no choice, but that I couldn't even think that I'll go to higher education. But now after that, she's coming back in the village, and then husband has lost the job. She decides to buy goats and buffalo and start her business. From where she must have got money? It's like, as you mentioned, Ashu, that they are daughters. I mean, parents are not ready, no collateral, but you get from friends and family. Take a risk, right? This is like you borrow. Banks are not giving. Capital is never unlocked for women. That is number one. And the second, for rural women, no way. So in that situation, she actually does the business of milk vending in post-pandemic, where there is a lockdown. She sells milk, give a job to her husband. That, okay, I have a client, you go and just do the milk vending, and sends the bill digitally from mobile. And create is the digital source of money, not only just, I always tell in Mandeshi Bank or in Mandeshi Business School that teaching is just not enough. You create the ecosystem, right? I can talk about digital literacy, I can talk about that, but how is she going to get digital money? So she uses the app, Mera Bill, and through app she sends the bill and tell her client that send me digitally. So then she creates her own source of digital money. And when I'm saying that when these are the challenges in rural India of connectivity, of not having cell phone with you, not having bank account, forget about loan. In that situation also, Manisha rise, as the topic is like, awake and rise. She rise and get her digital money in her e-wallet and then do digital transaction also. So in such a situation, I see that rural women, their life is fragmented. Nothing comes to them very easily. Women, nothing comes to them very easily. Rural women, no, not at all. But in spite of that, when you see the numbers of India also, right? And you see that microcredit is more than $30 billion industry. Then you raise the question where the money is going. In spite of that, you see that if there is a fund which is declared by government is 10,000 crore, then you raise the issue that why women entrepreneurs, this capital is not unlocked. And so I would just say that, it's so important that economic growth just cannot happen. That is one. MSME growth just cannot happen. That is two. Where the first M, which is micro, and then women entrepreneur, if the capital is unlocked to them, and who will create jobs? I would just say that, our thousands of women are making today more than millions of masks. And these women who are doing businesses from the home, they are creating the jobs. So even if now everything is, we are coming to a new normal. So I would just say that these rural women, in spite of so much of challenges, they are shining. The matter is to recognize that, to invest in them. And I would end with it that Mandeshi has every year we reach more than 80,000 women every year. They start new businesses, they scale it. But I mean, how many Mandeshis are we going to create, right? About that, how do you unlock this capital for these women entrepreneurs who do not have collateral, but they have a trajectory, they have a footprint of their cash flow. And so I think the mainstream sector has to reinvent their intervention, reinvent their product and processes, observe these cash flows, and and unlock the capital for these women. Then they will set up the business, they will scale, and they will use all the tools in spite of their non-education, digital tools, and use the e-wallet. So I would just say that they are ready. It's a matter of us to recognize them, observe their talent, and invest in them.
Thank you, Chetna. That's a amazing story of self-reliance, actually, right? And how women in these times have become entrepreneurs. And it's about the old proverb, which is proving right, where necessity is the mother of invention. And most of such quotes end up being attributed to women, right? And at the same time, you mentioned that there isn't capital being made available, and it becomes even more difficult if it's a woman entrepreneur, because we don't have those kind of ecosystems that support women. While I know some initiatives are being taken up by the government, at the same time, I think it's not only about leaving things to the government. If I look at the corporate sector, with so many companies being all over the country, and with CSR now being made mandatory, it's been a couple of years now, there is a lot more that can be done from the perspective of bringing women into mainstream. And here I would like to share with you that at CRISIL, for us as part of corporate citizenship, women empowerment is our core theme. And we've really taken up the cause of capacity building and creating that understanding of finance at the rural level, in the poor areas. And we've so far taken Assam and Rajasthan. Both are very well known for their handicraft. If you think about Assam and you think about weaving, and you think about who's at the forefront in both cases, by and large, it's women, and it is micro entrepreneurs. But the problem that happens is that, if the woman doesn't know how to balance the home budget, actually those families go into debt. And we've seen our intervention actually prevent families from going into debt, and more importantly, through understanding finance, understanding a lot of the government schemes, knowing how to make use of them, whether it is opening a bank account, whether it is enrolling for the pension program of the government, or insurance, or medical care, it's always, if you educate the women, then you find that the whole family gets educated and actually progresses. I'd like to understand from our fellow panelists, and I know Chetna has already spoken about it. Meena, let's start with you. On what are you doing beyond the core work in terms of really contributing towards the cause of women empowerment? And also, I would say, what more do you think should be done by the corporate sector?
So, just like you correctly said, Ashu, that a woman who can balance the budget of the family is the one which will make sure that the family is not getting into debt. I think equally, healthcare tends to remain in the hands of women. They tend to take more accountability for the healthcare of their entire family. And not just their family, I believe their extended families and their communities. The healthcare, the caregiving, the worry about what to do for whom at what point in time is something that women tend to take a lot of leadership in their own communities and families. So a lot of work that we do is around at multiple levels. First and foremost, we work with a lot of rural communities to create employment for women who can become caregivers for families. So there's a lot of work that we do in identifying which are the communities, what kind of people, how do we train them, how do we make sure that they're comfortable when they move into the bigger towns to do these roles. And managing that entire pipeline, that's a very important piece of work that we do. Now, for those people who are actually working with us or are in this particular field and providing services to patients, we invest a lot in training them on not just the skills that they need to run that service that they're doing, but to manage their own personal self. First and foremost, I believe that the woman who is providing a service to somebody needs to have their own self-esteem intact. Especially when you're working inside somebody's home, it's very easy to be pushed around, to be treated at a different level than what you're supposed to be. You're a medical professional. You need to be treated as such, not as somebody who's who can be pushed around and asked to do anything and to be treated poorly. They need to really stand up for themselves. So we spend a lot of time ensuring that each of these women understand how they need to be positioning themselves, how they need to at one hand, they're being empathetic and being the right service provider. How are they taking care of themselves? So this is the second thing which is very important for us. Third is, many of these are probably the first time employed from their family, and many a times they come from smaller towns. They have to send back the money to take care of their families. So again, ensuring that piece is well tied up. They are not squandering, they are not putting the money into a place, it's a black hole, which is never going to come back. How do we ensure that their finances and their future is secure? Now, this is at the individual, at the people who we hire and who become part of our organization. The other is what we do with the communities. We are doing a lot of work now along with the public health system to see how some of the work that we've done around COVID, how do we repurpose it and make it useful so that the community can get a much better end-to-end healthcare system. And here, in most of the cases, it's a women, like I said, whose either their health is being disregarded or they are taking the responsibility of health for their family. Either which way, they are the ones in the forefront. So creating a much stronger healthcare management pathway for them, a long distance, and not long time healthcare pathway, not just episodic, but over their lifetime, is the health of the family and of the community being managed the right way, is something which really empowers the women in those communities. So these are just examples of the few things that we are doing, which would really help, I think, in the long term, make a difference to the individual families as well as the communities.
Yeah. No, thank you for sharing that, Meena. Clearly, at this time, it is healthcare, which is most important. And like you rightly said, apart from finance, or if you educate the women about finance, then the budget gets balanced. I think you're very right. It's the women that take charge of the health of their family, their community. And it's so good to know that your work is also covering rural India, because like Chetna mentioned, that's an area where healthcare is not anything to speak of. In fact, beyond the government hospitals, there are no private hospitals. So, Meena, on the rural side, is it really about training them to be able to then come to the larger cities to be care providers? Or are there any plans to really cover rural India as well from Portia's perspective?
So Ashu, both the things. First is, of course, it's an employment opportunity, and we do help women get ready for that particular opportunity that's coming their way. But what we are now doing, so let me just roll back of some of the things that we've done during the COVID period. That we've worked with 6 state governments to help them manage COVID positive patients who are either asymptomatic or mildly symptomatic and hence are home isolated. They don't need to go to a COVID care center or a hospital. So, so far about 120,000 patients have been managed by us across the country through remote monitoring of their health, providing teleconsultations, and then working with the government to shift people to hospital if they so need. And hardly 2.5% of these 1.2 lakh patients have had to move to a hospital. Now, in doing so, we put together a very detailed protocol which combines telecom technology, local on-ground presence, as well as doctors to put together a remote solution for long distance and long-term management of health. Now, the same thing we believe can make a big difference in the health of the rural population and semi-urban population where good quality of healthcare is not really available. And if it, for every bit of healthcare that somebody needs, if they have to take either they have to walk to some place which is a few kilometers away, or they have to take a bus and go to a different town, then they tend to pay a lot less attention to that. They don't want to do it so easily. It's time, it's expense, it's probably taking away from their earning capacity. So if we can bring more healthcare to them at their doorsteps, at their homes, that's the piece that now we are working on, along with a number of organizations which work locally, to see how we can train people there, deploy them there where they are in the same rural locations that they are, with a complete coverage of technology and telecom and medical protocols to make sure that this is providing the service that the individuals need. So it's the models that have worked elsewhere, we are now finding a way to deploy them in the rural communities as well.
Yeah, no, it's fascinating to see how technology has become a key enabler and almost a kind of savior in this time, where through telemedicine and all of that, you're able to reach out healthcare in places where otherwise there is little or none.
Yes.
So Chetna, wanted to ask you on how are you creating awareness around these socioeconomic disparities and inequalities? Because I know apart from the bank, there is also a business school that you have. So would like to hear your thoughts on this.
So actually, while Mandeshi has a business school, and this business school is particularly for those women who have never been to the school. And Deshi MBA courses, and the business school is, the whole idea is that you come to the business school and you don't look for the job as MBAs do. You start a business, right? And that, it's so, I'm so proud to share with you that when now with this whole technology tools, what you are talking and about the financial management, and I'm also proud to share that CRISIL and Mandeshi did this credit rating tool and scorecards for women. So it's like, I got a business school, I know my finance, great. I also weight my finance, I know my cash flows, and based on that, I know that my eligibility of the lending credit is this much. So I think practically how much finance I can handle, right? So business school gives this Deshi MBA where women go through these exercises of getting it, making it simple, wealth cards, that what wealth I have. I own animals, I own land, I own, food grains or wood, all those agriculture as other assets are there. How much value I have. When you talk of equity, talk of all those things, but these women have very clear ideas how much wealth I have it. So just to go through that exercise on business school, then we have radio, where women are radio jockeys also. And they run a program where women share their not only just success stories, of course, success stories are there, but even failures. When my business didn't work, what did I do? When bank told me we cannot give you loan, what did I do? And I think how they have addressed it, how do you put their learnings into these courses of business school, right? And where, while putting it into it, you need experts like CRISIL who can help these things, like the way we design a scorecard for our women, where they can calculate and say that, okay, I am eligible for the loan. This is my footprint of the cash flows. So this is what we work with women. And I'm so glad that in this time where Mandeshi had a doorstep business school also, but now it has a screen business school also, where women come on Zoom and they actually share their business plan on Zoom. And when they can share to other women, they can share to bank. And I would just like to say that with this whole scorecard, now we are partnering with State Bank of India to go all over India and create these tools for women in business school, where this will equip them to go to the bank, to have a proper linkage, to get the capital. And also simultaneously, the business school or Chamber of Commerce helps them to create the e-marketing platform. So these are different things which we are exploring with radio, and this is all operated by rural women. We have a helpline where our rural women address the women.
So that's really fascinating. I mean, it's amazing to see how a business school is not about taking up a job, but becoming an entrepreneur. Really hats off, Chetna, for this absolutely incredible method of creating entrepreneurs. So, Revathi, you spoke about how in these times you've kind of, in a way, not only just focused on giving the employment for women in Hey Deedee, but their husbands who lost the job. But staying on the theme, what do you think should be done in terms of encouraging more women to join the workforce?
So I think one of the things that is very crucial is a woman at least the pyramid that I deal with. Even if they are contributing by way of their salary to the family more than what the husband is contributing, because his money most of the time would go into some drinking and stuff like that. So she's actually contributing a lot more. They don't think of themselves as primary breadwinners. It's always, if there's anything which is wrong in the family, in the sense somebody is not well, whether it's parents, in-laws, whatever, it's she who stays at home. And it says, mere ko jana padega, you stay at home. So that primary, saying that I am the primary breadwinner, I think that one of the things that we educate them or mentor them on this also is that please start thinking of yourself as a primary breadwinner. You are contributing to the family. That's one of the things that I think is very crucial when we are mentoring them. Because when they come to us, and we are doing a lot of capacity building and all that, so when we're doing that, we have to actually mentor their families as well, because it is, unfortunately, whether we like it or not, the point is that if she has to come out of the house, there is a consent needed. We may like to say that no, but women should not be like that. Fine, but well, they should not. But the point is that they are, and nobody wants to create a problem at home, discomfort and a discordant note at home, and then leave home and come to office and work full day on the road, and then go back to a nasty family attitude, which will not help anybody. So we try to mentor the entire family towards that. And so this is one of the things which is very, very dramatic for us to be able to convince them. So then we use a lot of other tools, to make sure that they come to work. I don't know whether I mention it in a lot of places. In this segment of society, it is most of the time not the husband who's allowing her to come out. It is the mother-in-law. It is true. It is the mother-in-law. So we actually have something called a mother-in-law day, where when I'm training every batch of girls, we actually at the end of their graduation ceremony, after 2 months, we do a small little ceremony. They've never been to, they've never had this opportunity of throwing hats in the air and wearing a jacket and come. So we do all that. It's a nice convocation that we do. So when we do that, that's the time that we call the mothers-in-law, and we call it the mother-in-law day as well. So what we do is on that day, so this acts as a retention tool also for us. So what we do is we actually buy a gift for the mother-in-law, and we never buy small gifts. We buy big meaning bulky, not expensive, but bulky. So it could be 1,000 rupee mixie. That 1,000 rupee mixie gets me another 15 girls from that basti when she goes back, because the whole basti is following her to find out ye kya hai, how that this is how the slums are. किसने दिया, क्यों दिया, क्या हुआ, so मेरी बहू के ऑफिस ने दिया, अच्छा मेरी बहू ये काम करती है, it's like it goes on and on. So immediately after that we see a spurt of girls coming to us from that basti. So we are utilizing these unconventional and untraditional methods of getting more women to come to work, because I mean, there's no textbook. There's no textbook for us to follow. And while we are talking, and I, I was anyway going to write a mail to Meena, but since we're here, I must express my desire that we actually want to train girls who become those they go and check blood pressure and all that, no? So we want to do a whole lot of thousands of girls doing that, because we have a very great mobilization team which actually does that across many cities and rural areas also. So I actually want to start doing that, because I think there's a great opportunity, considering today's times, that women go out and get these tests and all done in. So I will write a different separate mail for that. So coming to the topic of mother-in-law, the mother-in-law is the very important factor in everybody's life, and we make her feel very important. So she feels very happy with us. She
Oh,
sends her daughter-in-law, makes sure that the dabba is given to her in her hand, and she goes to work. So, we have.
that's fantastic. I mean, it is these things, because obviously to be able to encourage women, you have to make those interventions which matter. Each country,
Because
yeah,
what to do? I mean, I don't see a textbook formula at all.
yeah, yeah.
And
No, completely.
we've lost a whole lot of girls because they've suddenly decided that मेरी सास ने नहीं बोला. So, after going through the training, attrition is so high. What do you do? So you might as well please her instead of, doing something with the girl.
Yes, absolutely. During the pandemic, right, and obviously it's nowhere close to being over. We've already discussed examples where there were a lot of migrants that went back to the villages. And not all migrants were the sort of the vegetable sellers or the street vendors. A lot of them were actually construction workers of very large companies. And this is one time where a lot of eyes have turned to large corporations. And, globally, ESG or environmental social governance has become a way to assess how different companies stack up. Even in India, the business social responsibility reporting has started. SEBI, in fact, is requiring companies to provide these details. At our end, we felt that one way to avoid migrants from going back to their villages was to ensure that they got food. Because see, in their lives, they have money for the day or the next day, nothing more than that. So after 2-3 days, there is no money to buy food. And because we had moved all our staff to work from home, the kitchen was vacant, empty. So we really, for us, that was like the machine, so to say, right? Because in our work, it's all research, it's all ratings. So we got our staff to cook these meals, and almost 10,000 were distributed in the area of our office. And I'm happy to share that we didn't have these migrants go back, because and we sustained this through 2 months, the April-May period, which was a very crucial time when it was a massive lockdown. And this made me believe that every single company has to rise above the so-called work that they do or CSR that they do, and have interventions that can really address some of these societal evils. So I'd like to ask you, Meena, your thoughts around what companies could do, to really to bring about more equality, or to rid their own ecosystem of such disparities and evils. Or do you believe that that's something that should be done? Let's start with that.
Well, each of us have the ability to influence in multiple circles. We can influence our employees, we can influence our customers, we can influence their families, we can influence their communities to behave better, to behave in a less divisive manner, in a more sustainable manner. So as individuals, as corporates, our responsibility is at multiple levels. Which of these circles of influence do we want to play with? Where do we want to make a difference first? Where do we want to go next? So one can play at any of these levels, and all of them are important. If you can change the life of one person in your company, great. If you can change the life of the 5,000 people that I employ, great. If I can change their families' lives, even better. If you can change the communities that they come from, even better. So it's really at what level and how much difference can you make? And the need also changes. For instance, exactly what you said, my husband and I, Ganesh and I, we got together and created this Feed My City campaign during the peak of lockdown. And so what tools do you have to your capability? So both of us are entrepreneurs. We know how to get people to put their heads together and quickly go from zero to something very fast. How do we get lots of people to come together and contribute to this problem that was on hand? So we were able to feed about 45 lakh meals we distributed during those 60 days period, which, like you rightly said, there were people, either migrant labor who had to go, who would run away, or they're local people and they have no jobs. What are they going to do? How are they going to sustain? So even if they don't go, they don't have the ability to go off somewhere. They have to live here only, and there's nothing for them to do. So some is very situational, some is more long term. So one has to look at both these axes and both these dimensions and see which circle, at what point in time, with what intervention, for a short period or for a long period. So obviously all of these are important things that we work on as, and like I was saying, we have number of companies. We have Big Basket, we have Portea, we have Home Lane, Freshman. So companies across multiple sectors, and each of them has the ability to influence a whole ecosystem that it has. So we're working with that to see how we can make a difference in their lives.
Yeah. So Chetna, coming to you, clearly it's the rural part of India this year, which is actually doing better than the urban part of India. So this is the time where Bharat can really shine. And you're at the grassroots in encouraging women entrepreneurship. You spoke about masks, etc. Could you share with us one or two interventions that you have done at this time to make sure that the rural women actually think on how they can, either grow their business, start their business, and how is that awareness around the new needs that are coming up being taken to them?
So it's very interesting, Ashu, that when after post-pandemic lockdown, particularly when the families came back to villages, right? And there are young women who are very aspired to do something, but at the same time, everybody would not like to, rear sheep, rear goats, to rear buffaloes, but they want to do something. And at the same time, they also are realizing that maybe in going back, we don't want to go back. And I find that the most important part is that yeah, why to have that vulnerability in city, staying in slums, right? So what we did is that immediately we started working at our business school and our bank, designed the different workshops and programs where these young ladies who are aspired. So we have this whole thing of everywhere in rural India, animals are owned by, taken care by women, right? But at the same time, there is a lot of challenges to get the veterinary services. So we designed a course of paravets where and then our women become goat doctors and chicken doctors and all that, and they have two-wheelers and they provide these services. So vaccination, insemination, all that. And when they go to the village with that, so it's knowledge and courage together, right? And, and at the same time, you get the dignity and it's sustainable. So they go to the village, provide these services, and farmers are paying them a little bit. And so then the other ladies also in the village, they see that, okay, there is no point in going in Mumbai and staying in slum. I will register for this course. So one, we started this. Second, I would just very briefly add, in similar way, we did this whole soil testing engineers, right? So these farmers who require a soil testing at their doorstep, what is necessary in your soil, they are ready to pay fees 50 years. And that lady can go in a day, easily she can reach, 50, 60 farmers she selects 3 villages. So they become a lab scientist for soil, particularly soil testing. And so this is another course which we started. So it is on one side we have goat and chicken doctors, and on the other side we have these soil scientists. These are women who go and do, and that whole training program, and we have linked with the agriculture universities in Shilwar, so that they get the experts also who come and teach them. So these technicians, I think, and then this is available. It is not very difficult and it does not require a big rocket science. But once they become that way, you'll be surprised that some of our goat doctors, they organize an animal market of buying and selling in the time of pandemic. They did it on WhatsApp. And so many
We can't hear you. We can't hear you, Chetna. You'll have to come to the floor.
Yes. Can you hear me now?
Yes, we can.
So I'm just saying that, in village, what do they require? Money, yes, but dignity, right? So these girls, when they move around as a goat doctors, chicken doctors, soil scientists, the other girls also think and get, and as Revathi mentioned, right, their mother-in-law thinks that, okay, my daughter-in-law will be. So I think there are new areas we need to explore, and there is a scope, and they are sustainable. There's no need to be everything grant-based, right? That is very important. And as you mentioned, सब कुछ सरकार करेगा, कितना करेगा? How much government is doing? So that we had totally around 5,000 women becoming a good doctor, and this model is replicated in Uttar Pradesh also.
Yeah. So, Revathi, just before I hand back to Aishwarya, just want to ask you, what is that one advice you'd like to give women who may have an idea in their mind, but just don't know where to start or how to start?
I think Meena may have been a better person to answer that. She's a very successful entrepreneur, but I'm still in my nascent stages, I feel sometimes, because I make so many mistakes that I don't know. Next mistake, I was a new one or an old one, I don't know. But yeah, I mean, as far as advice is, I think every entrepreneur's journey is very unique to them only. There's no replication of anything that happens. But uh, I think any entrepreneur, when they think of an idea, ideation is not everything. Ideation is only the smallest part of the journey of an entrepreneur. It is really the execution. And a lot of times, the execution is lost in the passion of an idea. It's happened with me. So, so I feel sometimes taking help, if you are not a good executor, you may have a brilliant idea, but you may not be the best executor. You just start thinking, that you don't have to know everything. As an entrepreneur, it is not required for you to know everything. You have to take help. You have to take professionals. I made this mistake of thinking that I know it all when I first started. Obviously, I don't know it all. I mean, but so you're bound to fail. So your chances of failing when you decide not to take help, professional help, is a sure shot success for failure. And then sometimes the best of ideas, you may need that very serious talent. Even if you are the best entrepreneur, you still may definitely fail, and you may have that serious talent to fail with a good idea because you are not taking help from anybody. So I think taking help from professionals is extremely crucial. I mean, that's
that's great. Meena, any last words from you on advice for our women, either who want to see what it takes to get to the next level or want to start a business?
So first and foremost, I think self-belief is, in my view, the most important thing, whether you are an entrepreneur or you're a career woman. The belief that you have a potential and you want to maximize it. You may very well believe that that is best done as a homemaker, and that's perfectly okay too. But whichever path you choose, if you decide to take a career or you decide to become an entrepreneur, that self-belief and that desire to push yourself to get to your maximum potential, that is in your hand. You can complain that mother-in-law said this and father-in-law said this and husband did. And I am not in any way denying that any of that is not a problem. It is very much a problem, not just in rural, in urban, not in slums, in well-to-do families, everywhere it's a problem. But at one level, you need to have the spark, you need to have the self-belief, you need to say that I'm going to really put my life behind this because this is so important for me. If you believe so, then you will find a way forward. Most of the times I find that the people who drop along the career path in corporates, and I worked for 20 years in corporates too, that it's not just because of what happens environmentally. It is about you don't believe that this is important for you, you're not fighting hard enough for yourself, that you tend to lose out. So apart from everything else that all of you have said, I think that is another piece that I want to reiterate again and again, which gets lost. Women are not victims. Women need to decide how they stand for themselves, how they make use of the most of all the environmental challenges or supports that they have. They have to maximize that. But the moment you consider yourself a victim of circumstances, then anyway, the game is lost.
Yeah, no, that's very well said, Meena. No, it's been a great discussion and I can see plenty of questions. So I'm going to hand back to you, Aishwarya, from seeing how can we take some of the questions from the participants today.
Yes, that was a great discussion, I must say. We have Maya, the COO for CRISIL, here with us, who's going to be mediating the questions. Maya, over to you.
Yes, thank you, Aishwarya. Thanks, Ashu, Meena, and Revathi for a very, very engaging and enriching conversation. So many valuable takeaways for all of us indeed. And from the chat box, what I see, so many comments, which clearly indicate that number of points have very strongly resonated with quite a few people. That's what, the comments are indicating. So I have, a couple of questions. And the first question that, I would like to direct it to Meena. And this question is from Bhavna. So Bhavna says, Meena, that hi, I'm into health and wellness coaching space. In India, I feel still not much opportunity in hospitals. It's a closed mindset. As an entrepreneur, how do I take it forward? How can we create more opportunities for health counseling in India's healthcare sector? So, Meena, it would be really insightful to hear from you on this.
And thank you, Maya. It's a good question that Bhavna has raised. So I believe that wellness and focus on maintaining health is not, if I may be politically extremely incorrect, if I may say so, it is not in the interest of the hospital sector. I mean, why would you want to worry about that? So after keeping my political incorrectness aside, that's not the place to go to it. But perhaps the place to reach is the corporates who are very keen to ensure that their employees are well and they're healthy, so that, again, if I may speak to the self-interest of all corporates, is that you want your employees to be well and healthy so that you can contribute the best with you. So just from that self-interest perspective, they are more likely to engage with you. So that's one. The second is, I actually believe that COVID has created an awareness amongst individuals too, that those that are unhealthy, those that have some comorbidities are the ones that are falling sicker and are going into hospitals. Otherwise, for the most part, 90% of people don't have any symptoms. They just, I mean, it's COVID, so fine, it's a flu, you're fine. But the ones which really get impacted are the ones who are sick otherwise. So that has also created so for physical wellness, but also for mental wellness. What this pandemic has done is it's created so much of uncertainty, so much of isolation, that it's put a lot of mental pressure on our mental wellness. So both physical wellness and mental wellness has become important in the minds of most individuals also. So this is probably not a bad time to find ways to reach out to consumers directly or through corporates. That I would think is a more likely and viable route for your business.
No, that's a great input. In fact, perhaps we are barking up a wrong tree by wanting hospitals to be more focused on wellness conversation. Perhaps we need to aim towards corporates and such other organizations who could. It's in their interest, in their self-interest to promote conversation around wellness. So that's a great input, Meena. Thank you for that. The next question is, on unlocking, capital aspect. And, this is something that I would like to direct it to first Revathi, and then Meena, I would also like to have your comments on this. So Anuradha is asking, apart from rural women, how and where can educated women in cities get help and capital to establish themselves, get self-employed, and in turn also create employment for others? So Revati, your thoughts, and Meena and Ashu, please feel free to share your inputs after
So I think capital, we have a banker sitting here. So I think we should just go to Chetna. So definitely. But on a serious note, um, getting capital, I don't think, I mean, in a lot of ways, um, it's seems very easy sometimes, but I have personally made about 55 pitches till I got my first investment. So very, very tough. I mean, I found it very tough. Once you do a POC and you establish yourself, obviously the investor wants to know where that money is going. They're not going to just come and give you money just because you think, and every entrepreneur thinks their idea is brilliant. So I've never heard any entrepreneur say that, my idea is not good. So everybody thinks their ideas are great. But unless you cross that one step of POC, and how many times you'll fail to first reach that POC. So getting capital is from where again India is not yet ripe, I think, at that stage where you just walk into a bank and say, I have an idea, and so you fund me. That doesn't happen. We are still on the, do you have collateral? The collateral loans are much more uh, easier. HP loans are easier, hypothecated loans. But even to get a hypothecated loan, you have to actually show the income coming in. So there are a lot of ifs and buts. I mean, I've gone through this many, many times. And because I deal with the lowest end of the pyramid, I have also issues of CIBIL with the girls. There are a lot of credit rating and stuff which goes on. So it's not as easy. But so capital, I think, is a very, very difficult subject to, kind of generalize. It all depends on every individual's own credit ability to raise whatever finance. Businesses becomes a lot easier when you prove what you have done. So that is one. What was your second question, Maya?
So it was not just about capital, but it was also about, seeking help. So how do educated women in cities, where should they seek help from?
Yeah. So there's a
In
very
fact, we have Chetna's example where she has created these resources like Chamber of Commerce and Deshi MBAB school. But for women in cities, perhaps, it's so vast that sometimes we may feel lost.
yeah. So I think there is my personal opinion. It's why do we always say rural poor? Why is it that rural poor need this? There's a whole lot of urban middle class educated women who actually need a job. They just don't have jobs, they don't have means of earning. In fact, during the pandemic, what has happened with us is that we've had um, the profiles of women who have come to us for jobs during the pandemic I'm talking about, right through the lockdown, where we also gave jobs during the lockdown. There were women who were graduates. There were women who were HR professionals. There were women who came from the retail segment, who were, just not being able to get out and do work. Those are the women who came to us and said, I need help, I need to pay my bills, so can I work? So the only two questions we asked them, do you know to ride and do you know to drive? If you know either of these, we are going to give you a job. So I think the urban class of educated women who would always have probably gone for office jobs, and I don't know whether they want to come and ask for help because maybe it's not in their socially, again, a concept of, whether mentally I can accept it. Is it a mindset? Should I become a rider? Should I become a driver? I don't know. So these things I think are all part of the game. And just 1 week back, I've had a 62-year-old lady, 62, she's all silver head. She has joined me as a driver. She's just came and said that I have there's no job. I know driving. I can work for 18 hours if you want. She's come and joined us as she came to ask for help. And she just, these are my I get inspired by these girls, women, I get inspired by them. So they have to come and ask. I mean, I don't think there's a chamber which can say that you can go and ask for help here, you can go and ask for help there. वो सब नहीं होता है. But I guess we have to find our way of how to do it. And banks typically, I don't think, are the absolute sure shot way of getting finance for new businesses. I don't think, unless there's a collateral and stuff like that. Now, Chetna can correct me if I'm wrong.
So I would also add that in big cities, there is the TIE, which provides a lot of support to women who want to become entrepreneurs. So that's something they can just look up that and go and meet some people. It helps build a network of others like you who have got ideas. There are sometimes separate women's chapters for in TIE. There are other similar organizations which work only with women entrepreneurs, helping them improve their capability, their product, their reach. There are specific funding agencies which only fund women entrepreneurs. So all of this is certainly available and worth. If you're building a funded business, then you want to raise money, there are all these things that need to be explored. Nothing is easy. You have to pitch multiple times to get money, but at least you get connected with the right people, you know how to go about it.
Yeah,
absolutely.
I would just add that, the whole point is that the mentorship aspect, especially when you are, how do you make the pitch for the first time entrepreneur, becomes a big challenge. And that is where seeking help from friends, colleagues as the first point, somebody who's already done a business, so that you can frame your proposal sensibly and receive, like, they said, if you have collateral, it's a little easier. Otherwise, it's very, very difficult. Then you really start looking at some of the early stage, either the angel financiers or the VCs, and how do you go about it. And I would, to contextualize today, because I have seen a lot of women set up new businesses, and they all are in the essentials category, whether it is food or some form of a immunity care kit, so to say. All of them have actually used the internet and the web very, very effectively to learn and to spread the word, because platforms such as Quora, for example, they're available to anybody who can read and write, right? And the beauty is you will have people who will connect you to others. So leveraging the internet is become even more important today, because there are so many institutions who you do not know how to go to, right? There are so many who are working from home that you just don't know who to go and seek help from. So I would actually urge a lot of women, rural, urban, wherever, to really get some of the answers. Then you'd be surprised on how easily and how quickly you get a response.
Yeah.
And by experienced professionals, actually, which in the normal time would not really have the time or the bandwidth to help.
Right. So Chetna, as a banker, how do you solve this capital conundrum? Because you must have been experiencing a number of prospective borrowers who do not have the luxury of having a collateral, and most of them would be first-time entrepreneurs. So, the fact that you run a bank, you have to be mindful of your NPAs, but at the same time, you also want to encourage a whole lot of women to take up entrepreneurship. So how do you balance these two objectives?
First, respond would be that simple thing is that when I'm putting my new business, nobody is going to come and invest, right? But at the same time, there are, particularly in this country, India is risk averse as far as investment is concerned. And when I say that, I don't say it with complaint, actually. Why I say is that things are quite complicated here, right? For investor also. Now, say I get so many friends who would say that I want to invest in a business of women with whom you are working. And when I talk to our women, like who is making masks, who is in textile, who is in food industry, she doesn't have a structure. Now, if she doesn't have a structure, where that investor is going to invest? Now, I am again not complaining that why she doesn't have a structure. Because to form a simple company in this country is so difficult, right? LLP or private limited or whatever. And we don't even, at our bank, we don't even talk to that level. We don't even tell women that, form the private limited company, then the investment will come. No. Or then the credit will come. No. Have a simple things are like, have a udyog aadhar. Proof of some businesses what you are doing. Have your trajectory of which I mentioned before also about your cash flows. Those, and unless you have this, then people would know, right? That yes, this is the way I would invest. That is first reaction. The second, which I want to tell entrepreneurs, that those who want to start business, they shy away from giving high returns. I mean, it's not, shy away. They feel so much of risk from the entrepreneur side. Investor side is that I want to give, but I want to make sure what are the returns. I want to make sure what will be the tenure of recovery. I mean, repayment. But with the entrepreneurs, I saw many times like these young girls, they get award and there are investors sitting and they have this preconceived thing that investors are going to ask me 30% returns in equity. That is, why do you have these fears? Talk to them, negotiation. I feel that we do not, and I absolutely agree with you, Ashu, that, we are a bit scared of negotiating. And I think that is very important. And with women who are setting up the business, I feel that negotiation powers has to be there. And it's like, okay, I will not be able to handle this much of return, but I will be able to give you this much. Or some confidence level, right? So I feel those negotiation in banking also becomes very important. Banks are going to ask you 100 questions. They are not going to, because they are giving money, right? How do you convince them? And that I think skill building is important here, which we keep, that mentoring is very important, where we say Udyam Sakhi, that they take you through the journey of your balance sheet, how the money will come. And here I would also add one part, I mean, not to make too long, but it's also important that you need these de-risking and risk sharing. So if I am saying that we are supporting women, then I would say to investor that 20% of marketing of her product, we will do it, right? So that 20% income comes, I take a risk. Either it is NGO or it is company, whatever. But then the investor will be more comfortable that, okay, 20% sales are going to come, are going to happen. And Government of India has done like all these Udan schemes for new airport. They did that. So I do think that, these such type of institutions are necessary, which do de-risking and risk sharing for investors and bankers also.
Yeah, absolutely. No, that's
right. Chamber of Commerce does.
Yeah. No, so these are again, fantastic inputs, Chetna. And you touched upon a very important aspect, in terms of negotiation, ability to negotiate, and not shying away from negotiating. And as Meena also mentioned, self-belief. These are some very important internal barriers that women have to overcome really in order to succeed, either in their entrepreneurial journey or in their professional career. So, so this is, it's 2 o'clock and we are on time. So Aishwarya, we are almost at the end of this session, and I can hand it back to Ashu, for her closing remarks.
Yeah, thank you, Maya. Thank you, Chetna, Meena. I think Revathi had a flight, so she's left. But this has been a very engaging conversation. I really love the way that each one of you contextualized it to today, because that is what resonates. And I didn't want to make it a academic discussion, because our people who've participated today want to know what we can do now, or what we should do differently now. So I just want to close with thanking you, and also sharing the thought that when women progress, everybody progresses, because inclusion really starts with the women, and more women being included in every sense of the word, whether it's in the family and decision making, in communities, in companies, in the broader society, in policy making. So here's to women power, and really congratulations to all of you for all the good work and the success that you have. May many more be created like you, and may you sponsor many women to go on and do such wonderful work. Thank you very much.
Thank you, Ashu. Enjoyed the session very much. Thank you for inviting
Thank
me.
you.
Bye.
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 Thanks,
Stay
Ashu.
safe.
Thanks, Coacharya.
Thank you. Thank you, everybody, for being here with us.
Yeah. Bye.
Thank you.
मैम वो इलेक्ट्रीशियन एक 17 से आया है।